Hello, I am Dr. Ted Hudspeth, and today's webinar is the second of the On-Demand Telehealth in Practice webinar series. And today we will talk about professionalism and legal considerations. If you weren't able to join us in the previous sessions, these recordings are all available on our website for you to be able to view at your convenience. All of the sessions in this webinar series are listed here and will be recorded and available on our website at walpen.org/telehealth. And this list that I'm going through shows all of the different versions and presentations that we have. And today's, as you see, is the second in the on-demand series. As a reminder, this webinar series is funded in part by the TxLA Telehealth Resource Center. TxLA is an HRSA-funded program at Texas Tech University designed to provide technical assistance and resources to new and existing telehealth programs in Texas and Louisiana. TxLA is partnered with us at Wellhead, Louisiana, to serve as the support representative for Louisiana providers. TxLA is also part of the National Consortium of Telehealth Resource Centers. You can access the websites and resources from all of the TRCs across the country through the consortium website, and that URL is telehealthresourcecenters.org. So again, I'm Ted Hudspeth. I am your host today. And I have been from all over Louisiana, started in Amite, ended up going to college in Baton Rouge at LSU, medical school at LSU in New Orleans, and then I did my residency up at LSU Shreveport. For the last 27 years, I've been in Hammond, Louisiana, and in Baton Rouge, where I currently serve as the Ochsner Medical Director of Informatics for the Baton Rouge region. And so today I'll start off with a quote. Medical profession is a feat. It requires self-sacrifice, purity of soul, and purity of thoughts. So in thinking about today's presentation, I'm going to talk about professionalism. When you have a profession, there's a certain expectation that the members of that profession will live up to a certain standard. And that's no matter what profession you are in. And I guess what the big challenge is right now is that medicine is under a tremendous change. I mean, we are really changing everything that we're doing, how we're doing it. But there are certain aspects that we need to pay attention to. And in that change should not change, or the profession will change forever. So what I'm going to do is kind of go through some of those things to think about as we quickly change to where we're developing telemedicine as a mode of care or a mode of providing care. We need to pay attention to some very specific things that make our profession unique and special. So for the overview, we will talk about potential ethical pitfalls. We will go through the AMA Code of Ethics and the American Medical Association's Council on Ethical and Judicial Affairs. We will talk about telehealth regulation overview and also some legal considerations. So let's start off with telemedicine's potential ethical pitfalls. Electronic communication and healthcare are both changing. I've already alluded to that. And increased knowledge is required to give basic care. People are living longer, and chronic disease management and coordination also are gaining traction, especially in the telemedicine field. Primary care has little time to manage large panels. So right now we need more efficiency. And unfortunately, reimbursement has changed from volume more so to efficiency and care outcomes. So in our current model, it is not really designed for that. And telemedicine does offer us a very unique opportunity to capitalize on some of those changes and make everything more efficient and more effective for our patients. Healthcare and society are poised to take advantage of telemedicine, which could transform healthcare. Right now, we have capabilities through text, email, mobile devices, apps, remote monitoring, sensing, and also automated instructions and reminders that all can be wrapped into a telemedicine model. All of these things will engage with the patients more. And, as we think about all of this, our improvements in communications will allow us to do additional things through our EMR, through secure chat, with providers, amongst providers, also providing e-consults and later asynchronous e-visits for patients. So as we think about all of these different things, each one of them has a potential pitfall. And there are serious concerns about the impacts on care that these could have. So we need to ensure that ethically acceptable changes be held at a certain standard of care, and we should avoid these major pitfall areas. One is the erosion of the patient-physician relationship. There are threats to patient privacy. There are threats to patient care when we try to force a one-size-fit-all mentality in their care. And there is always the temptation to assume that new technology must be effective. Part of working in the medical profession is that we have always done things based on studies and proof of concept and proof of outcomes. And so telemedicine really should be no different. We're at a unique time in the medical profession where things are changing so rapidly with respect to the way that we deliver care. This is partly based on patient need and desire right now. People are busy, and telemedicine does offer them an opportunity to be able to obtain the care that they want and need under specific circumstances that they have time for. I mean, it's just a basic thing there. And it will be important for us all to maintain certain standards that we as a profession demand in our practice. And because of this, the AMA has put out a position statement. And basically, originally when they did this, it was that this telemedicine was intended to supplement our live visits and required a pre-existing relationship. As COVID has come about, that obviously has changed things and changed really how we've used telemedicine. So despite the presumptive value of a live visit for an initial patient-physician encounter, a major opportunity for telemedicine is really to improve the access to care and physicians in geographic areas where both are limited. We don't have many specialists in the rural areas, and having the ability to use telemedicine can allow them to reach out to people in rural areas where access is limited. And as society becomes more comfortable with telemedicine and electronic communication, all of this will evolve more and there will be a greater demand over time. So it's really important for us to address and answer all of these concerns about the loss of the patient-doctor relationship so that that does not stand in the way of modalities that can actually improve the access to care. So if we just think about these and employ the right methods of being able to conduct a doctor-patient relationship, make sure that we maintain those same standards of care, then I'm certain that we will be able to utilize this technology to help people and give them the care that they need where they need it. It is important for us to address all of these concerns, though, and strike a balance so that they basically don't stand in the way of progress. And that's where we as providers need to really not only think about, make plans for, and then implement specific things to maintain our professional standards and our interactions with patients so that we don't lose that. We all know that outcomes of care are better when the doctor-patient relationship are better. So this is another reason that we need to definitely maintain that standard. Another potential pitfall is the threat to patient privacy. This concern over privacy is really very legitimate. Patients may not know exactly who will be responding to and sharing all of their personal medical information, so they have concerns. That information is available on different devices and computers, and all of this increases the potential for security breaches, which may undermine patients' acceptance of telemedicine in the long run. With any asynchronous communication, such as with e-visits, patients really don't exactly know who may be even responding to their question and their problem. So this, again, raises some privacy concerns amongst patients. And these apprehensions are really important, especially given the uncertainties about the new delivery model of care. Security issues are more really operational than ethical, because actually new encryption and security tools are coming out all the time to help protect patient confidentiality and their information. So I believe that trust has been given, confidence has been pretty high amongst people who are utilizing telemedicine at this point, but we need to make sure that we continue conveying that and the steps that we're taking to protect their information so that they can be as comfortable as possible performing telemedicine type visits. Another potential pitfall is assuming that one size will fit all people. We have to make sure that we don't force the same solution on everybody in different clinical situation. Patients have specific needs and abilities and preferences. So we have to think about all of those. Patients differ dramatically in their adoption of new software. Text messaging may work well for one patient, but not for another. A patient-reported outcome questionnaire may be good for one group, but not for another. So various situations or problems, may be amenable to using some solutions and not others. Some patients may prefer a patient portal to a live visit, while others may not even have a computer to log on to. So you kind of have to think about that and decide, which one of your technologies you're going to use for which patient and for their specific problem. So, patient-oriented technology is not a one-size-fits-all. And I guess we need to think of all of the different modes of interacting with a patient like an artist would think about with his palette of colors. We have a toolbox of tools that we can use, and we need to figure out where we need to best use those to fit the patient's needs and capabilities. A fourth consideration is how telemedicine might impact the quality of care and whether its use will have the intended or an unintended consequence, okay? So in this case, new may not be better, okay? As with any new drug or device that we use, we really have to study how effective it is in doing what we're trying to do, and also to make sure that we're not having any unintended consequences or adverse events. So it will be important from a professional standpoint that we use evidence-based types of reasoning to employ certain technologies as we move forward. We have to balance our enthusiasm about doing telemedicine with the potential acknowledgement of the need for, clear-eyed evaluation over time. And so the second thing on this is we really need to be transparent about that with others so that they see exactly, why we're using various things and why it may not be good to use others. So in conclusion on all of this topic with the potential pitfalls, ultimately we need to think about the same ethical issues in telemedicine that we've also used when caring for our patients in person. If we focus on maintaining a strong patient-doctor relationship, if we protect patient privacy, if we promote equity in access and treatment and seek the best possible outcomes, then telemedicine can enhance our practices and patient cares in ways that everyone can feel comfortable over time. As we really, we have this great opportunity to change things for the better, but we have to make sure that we work towards that and make sure that it ends up in that manner. So I'm going to go through some of the AMA Code of Ethics. The AMA Code of Ethics has some generalities. And in general, telehealth and telemedicine span a continuum of technologies that offer different ways of delivering care. We need to be able to trust, though, that physicians will place patient welfare above other interests. We need to provide competent care, and we need to provide the information patients need to make well-considered decisions about their care. We also need to respect their privacy and confidentiality and take steps to ensure that continuity of care can be had with their physicians. So although physicians' fundamental ethical responsibilities don't change, the continuum of possible patient-physician interactions in telemedicine give rise to different levels of accountability. So think about that. There are different levels of responsibility that we have based on the types of interaction. So we'll kind of go through some of those. All physicians who participate in telehealth and telemedicine have an ethical responsibility to uphold fiduciary obligations by disclosing any financial interest that they have in their particular portal or service that they are utilizing to see the patient. So in this scenario, physicians really need to disclose any conflicts of interest in going into the relationship whenever they do that. If they are providing specific health information or health content on a website or a mobile health application, the physician also must ensure that the information that they provide is attributed to them should be accurate and objective. So, especially with the recent pandemic, with this huge variance of ideas on the internet concerning vaccines and effectiveness and all that kind of stuff, it really does concern me that some may be putting out information without any evidence to back that. And some of that information may be used for personal gain, without the patient's welfare being respected. So we need to pay attention to that and call those things out when we see them occurring. Now, physicians who participate in telehealth and telemedicine must also assure themselves that the services that they are going through have appropriate protocols to prevent unauthorized access and to protect the security and integrity of patient information. We need to make sure that companies that we work with are basically living up to the HIPAA standards of care, et cetera, and are taking steps to protect patient confidentiality and patient information. And we also need to make sure that any personnel who are providing any services to the patient are consistent with their individual roles and licensure. So this is a tall order that you have to do if you're going to maintain your professional standards when working with a company. Now, the AMA Code of Ethics also has some very patient-specific recommendations. And this is mainly when physicians who respond directly to individual health requests, there are things that you need to do. One is you need to inform users about the limitations of the relationship and the services provided. You should advise site users about how to arrange for needed care and follow-up when it's indicated. You need to encourage users who have primary care physicians to inform their doctors about the online health consultation, even if in-person care is not immediately needed. So basically, they need to tell their doctors that they're doing all of this. And then the physicians who provide clinical services through this method also must uphold the standards of professionalism expected in an in-person interaction. They should also follow appropriate ethical guidelines of relevant specialty societies, and they should adhere to applicable laws governing the practice of telemedicine in the specific states where the patients are located. Also, the provider should be proficient in the use of the relevant technology that they're using and be comfortable interacting with patients electronically. They should also recognize the limitations of these technologies. And basically, if they feel like they're not providing the standard of care, then they should take appropriate steps to overcome those limitations or ensure that the telemedicine visit be converted into an in-person type exam so that they can follow the standard of care. They should also be prudent in carrying out diagnostic evaluations or prescribing medications, and they should do it in this way. They should establish the patient's identity, confirm that the telehealth or telemedicine service is appropriate for that patient's individual situation and medical needs. And they should also evaluate the indication, appropriateness, and safety of any prescription in keeping with the best practice guidelines and formulary limitations that you would do in person. They should also be documenting all of the evaluation and prescriptions so that that can be conveyed to the provider's normal healthcare provider, okay? Some other patient-specific things that should be followed according to the AMA Code of Ethics is that when a physician would otherwise be expected to obtain informed consent, we must tailor that consent to be able to be provided electronically. And information about medical issues and treatment options should also be given to the patient, and they should have a basic understanding about how these technologies will be used in their care. So for instance, they need to understand, for instance, if we utilize blood pressure cuffs or glucometers, how that information will come into the system, how it will be utilized by the people who are looking at that and then making recommendations. And we also should be providing with them the credentials of the healthcare professionals involved. For instance, in our digital medicine program, we have health coaches and we have PharmDs, et cetera, in our group that provide these services, and that information has to be provided to patients ahead of time in their consent. As in any interaction, we should take steps to provide some continuity of care. If you are going to only be seeing the patient one time, then you need to make sure that you transmit any of that information that you developed directly to the patient's normal provider so that there can be some continuity of care that can be maintained. And, you know, collectively, not just doctor specific, but collectively through our professional organizations and institutions, there are several things that we should be doing to basically make sure that all of these ethics are upheld. And that is, we should support ongoing refinement of the technologies that we use and development of implementation of standards to ensure safety and quality of care. So that's basically, we should go through our own societies and organizations to continue advocating for these types of ethics. We should advocate for policies and initiatives to promote access to services for all patients who could benefit from this. So this is basically, you know, really a nod to doing everything we can to provide these types of services to people in need, especially in rural areas, because they have a higher need than others. And we should routinely monitor the landscape to identify and address adverse consequences due to these technologies or the use of telemedicine. And we should encourage dissemination of this information, both positive and negative. So that basically is a nod to transparency. If this technology is being utilized and is good, we should be saying that, but also if things are bad, we should be very transparent about that so appropriate decisions can be made not only by providers, but by patients as to whether they should use this type of technology for their care. So a lot of this information that I just went through came from the Council on Ethical and Judicial Affairs. And I thought it was interesting to kind of go through that. They actually came together and brought information from multiple stakeholders to be able to come up with all of their recommendations. And these recommendations basically became the AMA ethics policy. Initially, they issued opinions in the code that they had. And all of this strives to basically articulate the expectations of conduct when utilizing telemedicine. And they also provided broad guidance for ethics when providing care through these methods. So in kind of going through it, I thought of new ways to deliver the healthcare. You know, this is certainly new, but I mean, in utilizing the technology itself, but so much is really still the same or should be the same. You know, in thinking about all of these different things, we have different organizations that ascribe to or define what we're doing in telemedicine. And so HRSA, the United States Health Resources and Services Administration, says that telemedicine should support and promote long-distance clinical health care, patient and professional health-related education, and public health and administration. And CMS, which is the Centers for Medicare and Medicaid Services, says that telemedicine includes activities involving two-way real-time interactive communication between the patient and physician or practitioner at a distant site. So that's basically the definition of what we live up to when we're delivering care. So in telehealth and telemedicine, as in the other modes of care that we deliver, the patient-physician interactions really gives rise to different levels of accountability. At one end of the telehealth continuum are basically health-related websites. You know, these are where interactions between an individual seeking health information and the physician who provides that information is really indirect. The physician has very broad obligations to all website users, basically to provide accurate, truthful information. You know, but it is not specifically accountable to any individual information seeker. For example, like someone who comes to a website, physician experts are responsible for ensuring the accuracy and quality of the content, but they are not expected to be responsible for how individuals on the website actually act on the information that they find. So, you know, if someone is seeking information from a book or journal article whose author has ensured the accuracy of the content, they're not held accountable for the reader's individual interpretations. You know, at the other end of that continuum are interactions basically where the provider is giving direct recommendations or treatment, you know, through a website or through a portal. You know, for example, if an online health website or service where a patient can pose a specific health question and a physician basically answers that question and gives a response, well, in that situation, that physician is accountable or held accountable for, you know, that advice. So you need to think about that if you're developing some content online, you need to kind of think about, you know, where you stand in that risk pool, so to speak, because you need to be making sure that you're doing the right thing and have the appropriate coverage should something go wrong, and you would have some legal response there or some legal repercussions. So as far as physicians should also really develop new formats to follow patients with chronic health conditions. You know, as we do more and more with chronic health, like digital hypertension and digital diabetes programs, in that specific scenario, we are asynchronously working with patients and making recommendations. And in that scenario, the provider also does have a higher level of responsibility for the care that is being provided than as, say, compared to a website that they're just putting information on. So there are some familiar challenges and new contexts that we are using here with telemedicine. Right now, proponents of telemedicine highlight how all of these technologies give you a greater access to care, and they offer new opportunities for patient-centered care. But critics are often really more cautious. They do express concern about exacerbated risks of privacy and confidentiality and the limitations that electronically mediated interactions for physical exam and basically even accessing electronic media in rural areas may pose a really big problem and may put a bigger barrier to some people's access to care. So now I would like to talk about some of the risks to privacy that really might not be obvious to everyone, but it's something that you really need to think about. Electronic health and medical encounters involve a wider range of third parties these days than traditional healthcare encounters. Telecommunications service providers and possibly their affiliates are kind of all in the mix of this now. And there are healthcare personnel at both ends of the interaction, and they're involved. So you can imagine there are a lot more ways that things can get out of where they're supposed to be, so to speak. So some encounters are protected under privacy laws and regulation, but others may not be protected and can carry some additional risks. So for example, a website that offers health information may not actually be as anonymous as the visitors think. They may leak some information to third parties through code that is put on the website and can be implanted on the patient's computers. And similar concerns may apply to some home monitoring devices and mobile health applications. And some of the patient's privacy may be leaked through some of these types of things. So you kind of have to think about that now. We never thought about, bugs in our office, so to speak, listening to our conversations and being a risk to our patients. But when you're interacting through some of these portals, there may not be the safeguards that we always enjoy in a face-to-face or an in-person visit with people. Telemedicine may not be the right model of care for every patient. I alluded to all of this earlier. To begin with, the patient must have the resources, including the access and ability to use the technology. They also have to have an acceptable level of comfort in obtaining care that way. And despite its promise, telemedicine is not an appropriate care model for all medical conditions. For example, telemedicine is inappropriate for encounters when a hands-on physical exam is crucial or critical. And, in some other formats, telemedicine is not the preferred approach when certain things need to be done for patients, or you can't rise to the level of care that you would in an in-person visit. So in that situation, it's the onus on the provider that has to make that decision and change it into an appropriate type of visit. So this is usually when hands-on is needed, but there are also some other, social thoughts here. You wouldn't want to deliver really bad news to a patient that they have a cancer on a virtual visit. To me, those types of things should be done in person, and you need to kind of think about that. The flip side of it is that, there are situations where a patient may not be able to receive any care if they didn't do it through a telemedicine portal. So for instance, while you may prefer to see a patient for a given problem, say they're on an oil rig in the middle of the Gulf of Mexico. Well, a telemedicine visit might be the best thing for them, even though you would have preferred being in person. It's not feasible. And if a patient lives 6 hours from a specialist and doesn't have a car, well, that might be better handled through a telemedicine visit, because otherwise it may not have happened at all. So you just have to make sure that you match the mode of care to the patient. Trust and ethical practice in telehealth and telemedicine. Trust and ethical practice, that goes hand in hand. With these new models, as they continue to emerge, we need to make sure that our covenant of trust between the patient and the physician stays there. In any model of care, the patients need to be able to trust that what the physician says, and that it is truthful, and that you are placing the patient's care above all other things. That is called fidelity, and that needs to be maintained in your telemedicine type visits. They should provide competent care and provide information that patients and surrogates need to be able to make a good decision. And that's another part of being transparent. And then they should also respect patient privacy and confidentiality and take steps to ensure continuity of care. The task is really to understand how all of these fundamental responsibilities may play out differently in the context of telehealth and telemedicine, compared to an in-person patient physician interaction. So we really have to think about that when we have our fidelity in our visits. It has to be exactly the same to maintain our professionalism. Fidelity is really the obligation to put patient interests first, and it requires that physicians who participate in telehealth activities or telemedicine programs take steps to minimize conflicts of care or conflicts of interest and bias. It's important that physicians disclose financial or other interests that might influence them in their roles when commercial health websites and services are being utilized to inform patients or manage the patients. And there are different implications of competence, when you are doing things through telemedicine type interactions. If you just have a website with general health information, that's a limited responsibility. If your content, let me back up, your content needs to be accurate and objective. If you are doing a more personalized response to patients, then you do carry added responsibility. Your qualifications and experience need to be shown to the patient, and you have to take means to obtain crucial information from patients if you are actually giving patient-specific recommendations. Whenever you're providing full clinical services, you are fully responsible, and you need to be technology proficient so that you can utilize all of the services that are available. You also have to be aware of the limitations of the technology. That's part of your competence. And you need to limit the particular types of care that you give. If you don't feel that you are giving the quality of care that you would to an in-person patient, then you need to switch it to that type of visit. And there are different implications. We talked about the websites and the clinical services, but at the end of the day, we have to be able to provide informed consent to patients. In informed consent, you're basically giving some understanding of the credentials of the provider, how the technology will be used, and the limitations of the technology that you're using. The patient will also play a different role because they are responsible for determining if their own skill set is appropriate, and being able to utilize the technology to get on the visit. And you also have to be able to inform the patient and consent them that they can withdraw from the visit at any time and come in for an in-person visit. In privacy and confidentiality, website with general health information, they publish their policies. If you answer individual health queries, then the provider must be confident that that website has mechanisms to protect the confidentiality of individuals' information that is exchanged, and they need to inform website users of potential risks to privacy. And that's kind of one of the things that they all sign off on whenever they go on a website. If you're providing clinical services, then you have to adhere to sound privacy practices and assure that the collaborators do likewise. You also have to assure appropriate protocols to prevent unauthorized access and to protect the security and integrity of patient information. You have an obligation to make sure that you don't abandon the patient and provide continuity of care. And of course, forward your notes if the patient has another provider or primary care provider so that the continuity of care can be maintained. Of course, if it's just on a website, you're not entering into a relationship. But if there's an individual health query, you are, and that's where you may need to be providing some continuity of care. When you provide clinical services themselves, you should discuss how you're using the information and that you will preserve the information for future care and send that directly to their provider should they want you to. And you should provide the patient with specific follow-up recommendations and document that. If you're specifically collaborating with providers, then you should develop plans of care that ensure appropriate follow-up with them. And of course, you need to document all of this in your own EMR that you're using to care for the patient. So as we've seen, there's an evolving world of patient care. Telemedicine is providing us with access to care that we've never had. But at the same time, we need to be monitoring for quality of care and physician and patient satisfaction. And all of these things are a balance that we need to be paying attention to as our profession really guides the development of this over time. So now I'm going to talk about telehealth regulation and overview and go through some generally applicable guidelines. All states currently require a consent. Written is best if it's not required, even if it's not required. And patients can email, or we can receive a photocopy of a signature for this. Oral consent is acceptable in some states. When you establish new patients, you do it the same way that you do as an in-person visit. And you have to maintain the same standard of care. And establishing a diagnosis using acceptable medical practices and standards of care must be used. Otherwise, you need to offload back to an in-person visit. And individual states do have some state-specific guidelines. All states require that you explain how the technology works and explain follow-up, and you should comply with state record-keeping requirements. Now, there are some specific state-specific things that came up with COVID, and I'll go through Louisiana and Texas. The big topics for Louisiana included that any licensed provider could provide telemedicine services during the pandemic that we have. And also that it will be a two-way audio-visual type visit. They stated that we should be providing the same standards of care. Oral consent was approved by Louisiana, and they changed it to where no pre-existing relationship was needed. Also, they required that we must make attempts to verify the patient's identity. In addition, specific disclosures and documentation that was added basically included the following things. When we document, our name, address, and telephone needs to be on there. Our Louisiana medical license number, our specialty or area of practice needed to be in that information. We needed to state how the patient can receive follow-up and emergency care. We needed to list how patients can obtain copies of their medical records and that we ensure their transmission to another provider. We needed to explain how patients can receive care in the event of a technology or equipment failure, and that the patient may decline to receive services by telemedicine and may withdraw from care at any time. So that's all in most people's templates that they use for patient consent. They also stated that licensed out-of-state physicians could obtain an emergency temporary permit that was valid for a period of 60 days to respond to the COVID-19 emergency. Other Louisiana COVID-19 declarations included prescribing. All of a sudden, physicians could prescribe controlled substances via telemedicine if they had previously conducted an in-person patient history or physical on the patient. And special HIPAA privacy concerns included that we needed to provide notice of privacy practices to the patient. So that's the same as an in-person visit, that we provide HIPAA rules that we ascribe to. In Texas, they had the following rules that were basically added with the COVID-19 declaration. And that was that any licensed provider could practice telemedicine within the scope of their licensure. Telemedicine included the use of telephone-only visits and could be used to establish a physician-patient relationship, as well as diagnosis, treatment, and prescribing, provided that it met the standard of care. Out-of-state physicians and nurses could practice via telehealth in Texas if they have a valid license from their home state and are practicing within the scope of their license, but they must obtain a Texas limited emergency license. The patient also, the patient may provide oral consent for telemedicine, but you must document that in the record that they gave oral consent. And in prescribing, until the Texas state of emergency expired, advanced practice nurses could prescribe controlled substances via telehealth, and physicians may provide telephone refills of a valid prescription for treatment of chronic pain if they have an established patient-doctor relationship. All other prescribers may follow federal prescribing guidance during the COVID-19 emergency. So if you're hearing this from another state, you're going to have to look on your own state's COVID-19 specific declarations to make sure that you follow their guidance. And a brief on some legal information. Most insurers cover telemedicine, but you need to make sure that your malpractice insurance does cover for when you do telemedicine. You should also ensure that if you're going to be practicing across state lines, that your malpractice specifically covers that. In addition, written versus verbal consent. We've already kind of gone through all of the consent information that we need to be given. And of course, we need to obtain that consent before we do any recording of any encounter. If you're going to record or take photos or things like that, you should be making sure that you get an additional consent for that recording, and you have to be able to provide that recording to them if ever requested. And of course, all telehealth services must be HIPAA compliant. You need to make sure that if you're working with another company to provide services through their portal, that all be HIPAA compliant. And of course, you need to make sure that all of your practices be HIPAA compliant in addition. There's no differences between the HIPAA compliance of a telemedicine visit and an in-person visit. So in summary, primum non nocere. We've heard that a lot, I'm sure. Above all, do no harm. And, in our practices, that is what we all ascribe to do. We need to make sure that as we move forward in this wild world of telemedicine, as it evolves, that we build it into something that we as a profession can be proud of and can make it so that patients feel comfortable receiving care through this expanded model that we will enjoy as time goes by. In this, I have provided a number of resources for you to be able to go through in the PowerPoint handout. And these are included in all of our presentations that we have on the site. If you have any questions, you can email that to wellahead@la.gov. And you can view all of our other presentations at www.walpen.org/telehealth. And if you'd like to reach out to me directly, you can email me at tedhudspeth@gmail.com. I thank you for joining me. And if you have any questions moving forward, again, please let me know. And I thank you.